young lady is seated in a classroom. Looking around the room, she is certain that she feels different than everyone else. She feels like she doesn't belong. Despite her best efforts, she can barely keep her eyes open. She knows she has to get better grades or risk failing out. The pressure feels enormous and unbearable. Her parents have become alarmed, and upon seeing a psychiatrist, she was diagnosed with ADHD and something else, an anxiety disorder. Despite a titration of Lexapro and Adderall, her situation has become overwhelming and a constant source of racing thoughts and sleep disturbances. She has vivid nightmares, unrefreshed sleep, and incapacitating fatigue throughout the day. The young lady late into the night on her phone is searching for something. Anything that has the answers to her feelings of helplessness and inadequacy. She sees terms like bipolar disorder, PTSD, hypothyroidism, and fibromyalgia. She learns about proper sleep hygiene and has mastered numerous self-help books, yet she still feels terrible.
It's a common assumption that men have physical conditions that lead to sleep problems like sleep apnea, and women have psychological conditions leading to insomnia, like anxiety and depression. With all the sensors in a sleep lab, sleep medicine physicians can measure oxygen, airflow, calculate the frequency of breathing problems at night, but women typically don't exhibit the severe airway and oxygen issues of men. Unlike the loud snoring and gasping of men who receive serious attention from doctors, women can suffer quietly with unrecognized sleep issues that may seem easier to manage with psychiatric medications than respiratory therapies. The classic paradigm is that those who suffer from anxiety and depression will develop associated sleep problems, but rarely is it considered that physical sleep problems can be a major cause for anxiety and depression. We have the cause and effect all wrong, and understanding this can make all the difference. To best understand what I'm talking about, let's dive into some sleep studies.
This insomnia sufferer is having several respiratory events at night, causing gasping, tossing and turning, a racing heart, disruptions of deep sleep, and they are even provoking her to wake up. She is young, and because her oxygen doesn't drop, she could go unrecognized by traditional testing. Many such struggling individuals will awaken multiple times each night, tragically, and will struggle to obtain the necessary sleep stages required for proper brain functioning and mood stabilization. In such individuals, breathing disruptions can be infrequent compared to men, but each event may cause bigger problems like waking up in the middle of the night, severe heart rate spikes, as seen in this graph, that often go ignored and represent significant nighttime distress.
There are massive numbers of women in this country on escalating medications trying to manage problems caused by unstable nighttime breathing. Profound daytime fatigue looks exactly like ADHD. Constant nighttime physical distress can look exactly like an anxiety disorder during the day. Difficulty breathing at night can look like insomnia, and chronic sleep deprivation can look like a mental breakdown. The silent epidemic does not need to remain hidden anymore. With improved testing in the home and personalized interpretation and analysis, I've been finding out what happens when you treat disorders of sleep with deadly seriousness as diseases of the heart and brain. The benefits are life-changing, especially in young adults who are incapacitated by fatigue, cognitive impairment, and who have been traditionally neglected by actual medical doctors. When left untreated, nighttime disorders like sleep apnea will reduce life expectancy much the same as untreated diabetes or coronary artery disease, yet we never talk about it. Coming to see a physician like me may be the most important preventative health decision you will ever make.